Welcome everyone across the globe, whichever is time zone you're joining from, morning, afternoon, or evening. We'd like to thank you from AI Core Spot for joining us today for this healthcare webinar. We have a very interesting topic: AI in healthcare, bridging the gap between patient needs and the care delivery. Your presence adds great value to the session. I'm thrilled to begin by introducing myself and AI Core Spot to you. My name is Nitin Naveen, Vice President Innovation Strategy at AI Core Spot. And today joining me are my couple of colleagues, Arvind and Naveen. So a big applause to them for their efforts in kicking off this session. Let me take a moment to introduce our company, AI Core Spot. It was established 4 years ago and serves as a hub of knowledge specializing in a lot of emerging technologies, including AI, Gen AI, robotics, IoT, and much more. Our mission is to nurture a global AI-centric community where like-minded individuals can collaborate and share knowledge. We organize webinars, hybrid events, backed up by all our credible insights from industry experts, thought leaders, and amazing partners. For today's webinar, we are tackling a fascinating topic: revolutionizing healthcare with AI-powered precision. Our speakers will delve into pivotal aspects like role of AI, approach, quantum computing, metrics, future outlook, and much more from the healthcare sector. So, without wasting any time, I would like to introduce our esteemed speakers for today. So our first speaker is Archie. She is Chief Product Officer at GHX. Our second esteemed speaker is Tim, who is Senior Director Analytics at Premier INC. Our third speaker is Jeremy, Executive Director IT and Security at Mountain Land Physical Therapy. Our fourth speaker is Kamal, who is MD, MPH, Vice President Digital Ventures at Moffitt Cancer Center. And fifth speaker and moderator for today's webinar is Sandeep Punjani, Vice President Healthcare and Life Sciences at Infovision. Please note before we move on with this webinar that the views expressed by all our speakers are their own. It doesn't necessarily represent their respective organizations. So with that said, I'll pass on the message to Sandeep and kick off this engaging panel discussion. Over to you, Sandeep.
Thank you, Nitin. Good morning, good afternoon, good evening, depending on where you are joining us today. Welcome to today's webinar. It's a very interesting topic: AI in healthcare, bridging the gap between patient needs and care delivery. It's my privilege to moderate this thought-provoking discussion. I am quite passionate about healthcare technology, especially in the innovation side to improve the care outcomes. And AI is no longer a futuristic concept in healthcare. It's shaping diagnostic, treatment pathways, operations, and how we are engaging with the patients. But the core question remains, are we truly aligning AI innovation with the patient needs? We have a stellar lineup of panelists today to explore this. Let's ask them what their views are. Let's start by kicking the heart of today's theme. How do we use AI to bridge the gap between what patients' expectations are and what the systems are realistically delivering? So Archie, let me begin with you. How do you see AI most effectively closing the gap between the patient expectations and actual delivery of care?
So, Sandeep, let's be honest. It's 2025, and while healthcare is one of the more cautious industries, or has been one of the cautious industries in adopting technology, the consumer mindset has already shifted. Patients are expecting an Amazon-like experience, but healthcare is still running on systems that feel, sometimes decades behind. So the real opportunity of, any technology, including AI, is to collapse that lag and turn that static, latent data into real-time decisions and insights so that care is timely, personalized, and precise for our patients. At GHX, we are doing it in very many tangible ways. GHX is the backbone of healthcare supply chain management. And we essentially, our mission and motto is to actually make sure the right set of supplies are delivered to the patients at the right time, at the right price. Because as we talk about healthcare, we cannot ignore the waste an affordability piece for the patients. And I think that's what we all are looking for, because we all are patients at some point in time within this system. So it is about making sure that technology is enabling the right care at the right time and making it accessible and affordable for everybody. So I think that's where I think, AI quietly changes the game for us.
Absolutely. Tim, maybe I would like to hear your thoughts also on this.
Yeah, I think echoing some of the thoughts of the prior panelists, I would say that we do a lot of work in healthcare, especially to deliver insights on how to improve care. At Premier, our mission is to improve the health of America's communities, and we work with partners in pharma and life sciences. And I think one of the backbones of that is how much work has gone into the analytics chain, just trying to deliver those insights, right? And so a lot of our thrust is how do we get people insights on how to improve faster without them looking through 300 reports, without them combing through 4,000 measures, right? What's the canary in the coal mine, and how do we get that to them delivered so they can go back to their job, improving the health of who they serve? They didn't sign up, most healthcare organizations, to be analytics jobs. They signed up to help improve patients, but they need those analytics. And so that's a lot of what we're working on. And how do you smooth out the disruptive stuff that's going on? Even at the patient care, we have a clinical decision support system that many others have that help fire alerts directly to the EMR. So it's all about trying to streamline chairs of back and forth with AI, and just making sure that our providers stay where they are and our pharma clients, which is helping to improve the health of folks.
So Tim, what's the approach to designing an AI-enabled personalized care program that are both scalable and clinically meaningful?
I mean, I think it depends on the use case. It's what everybody says. It's kind of the pat answer. But scalable on one use case is not scalable in another. And I think it depends on whether or not you're playing for keeps. In prior life, I worked on ventilators, focused on death store. That's really playing for keeps. So I think it depends on how much are you playing for keeps, how fast the answer needs to be given, and then you work from there, right? It's kind of like you figure out the danger of the answer being wrong, how fast it has to be given, how accurate it has to be, and then you meter your approach based on that. You can't just have a one-size-fits-all, because something that's just an analytics decision that can come the next day is a very different scalable solution than something where you're ordering things or where you have to do something in near real time, like disease outbreak software that we have. So I think it just really depends on being situationally aware. Obviously, we're all in healthcare, and what the risk is to that. Is it light? And there's a whole different scalability model. If it's near nanoseconds or real time, all right, and patients' lives or the whole organizational health is on the line, then you have a very different decision tree, I think. And so that's kind of where you start and then move from there.
Yeah. So maybe Kamal, I'll come to you now. So you have helped embed AI and connected technologies into the care models. What are your thoughts? How do you see AI effectively bridging the expectations, the gap between the expectations and the delivery?
Kamal, I think
Kamal, you are muted.
Apologies. I was going to say I'm going to answer with two big trends that I see. I started in digital health before digital health was a thing, so back in 2005. And the consumer in 2005 versus the consumer in 2025 is very different. And what I have seen from a change in the digital health landscape, not AI yet, is that it has gone from something that we felt like we needed to impose on patients versus something that patients are now completely expecting. So when a patient comes to me today, they're expecting online appointment booking. They're expecting to be able to text me to tell me that they're not coming to see me anymore. They're expecting to get their medications delivered. They're expecting a level of convenience and a level of digital savviness from us that has come to become their standard of life outside of healthcare. And healthcare is still kind of like limping along a little bit, and we're still not quite there yet. The AI movement is going to be similar, where I think we're going to be used to a level of intelligence or artificial intelligence around us in our day-to-day lives in a way that we're going to start to expect from healthcare. And we have two choices as healthcare. We can either participate in this and make sure that it's done in a safe and effective way, or we can stay out of it and then sort of let the rest of the world catch up, and then patients will get what they need to get from AI anyway, and now we don't have the opportunity to make sure that's safe and effective. So when I go to boardrooms and hospitals across the country, that's what I'm telling them, is like, you can either play the game, or there's going to be someone in a basement across from the street from you that's going to disrupt your entire business model and make millions of dollars, and you're going to be staying outside of the fray. So I don't actually think it's a choice. I think it is something that we have to do. So from a patient expectation standpoint, I think it is just going to be something that they're expecting. And I think it's incumbent on us as a healthcare sort of infrastructure that we make sure that it's meeting their needs in a way that we know. And the other thing is, I think the demand and supply mismatch that is happening in healthcare right now, based on how many providers we have, patients are going to come up requiring us, that mismatch is going to continue to get worse. And I almost think that AI is a really great opportunity for us to bridge the gap between being able to leverage our physicians over a larger number of patients, because we're going to have to do that anyway.
Yeah, thanks. So along with AI, actually, quantum computing is also making its place in the healthcare. And Jeremy, I know you are closer to this topic. So what are your thoughts? How are healthcare organizations leveraging quantum computing? And knowing your security background, you can also share how are they ensuring that the patient's data remains secure?
Those are two good questions. I'm going to start with that first one of quantum computing and how it's currently being used. Right now, Microsoft is actively engaged in developing this, right? They've actually publicly released that they have the first chip ready to start using in their simulations. So this is coming on very quickly. I know right now research teams are actively engaging in modeling in preparation for quantum computing, right? What we can anticipate coming into the future with quantum computing is like drug discoveries and how fast that we can get to market with drugs, precise medications, right? Simulations to DNA medications. The effects of that in the human body will also become very aggressive and very fast to treatment. Radiology and imaging, right? We can anticipate very clear, very fast digital images here that are way more than we currently have today. But the thing I want to point out here is the quality of care is going to vastly leap forward when this comes into play. What things we can anticipate would be true in the moment life-saving measures with quantum computing built on top of AI, and the human interaction with both those happening simultaneously is something really exciting and something we can look forward to have happen. But as far as like the bad side of this and the security side of me, right? The adversaries, the hackers, that kind of stuff, right? We know healthcare is ripe for the picking, right? Where sometimes, and it's not just in healthcare, but just across the board, companies think about security second, right? They want to get to market. They want to make sure that they're making money, that kind of thing. More recently, we just heard about a big data risk that was publicly accessible, right? Where it had over 2.7 million patient records out there. Now, that wasn't even encrypted. Now, if we're talking encrypted data, and we're talking about data loss prevention policies that, we should be ensuring that our SaaS companies and our partners and our internal teams are abiding by, in preparation for quantum computing, we need to ensure that we know where our data lives now and ensure that we know how it's encrypted. We need to know how our staff are using that data and ensuring that the policies around all that are locked up now in preparation for when quantum comes on board. Right now, we know adversaries are stealing that data, encrypted data now, in preparation of using quantum computing to decrypt it later, right? If you don't have logging enabled in your environments now, that's a big risk to know that, in 5 years from now, when quantum computing, these adversaries have access to quantum computing, that all of a sudden all your patient data is on the dark web, right? So making sure that today you are doing preventative measures, doing proper vendor screenings, like your SaaS providers or your internal teams are doing all these things, right? That you're abiding by NIST best practices is going to get you there.
Thank you. So let's shift gears a bit to the operation side. This is an area where AI is rapidly proving its value, especially the post-pandemic. Tim, let me start with you. Let's talk about the supply chain. So how is AI currently being used to optimize the supply chain side and reduce the disruptions in the supply chain? Tim, you also muted.
Sorry. During COVID, we really started to look at this seriously because our organizations, obviously we serve a number of provider organizations and we have their supply chain data as they order and fulfill. We basically created an AI model to predict supply chain disruptions. It's over 90% accurate. We look at things coming in from the web. We look at our ability to look at what's being fulfilled rapidly, and we look at other trends, right? And so that surrogate of those different news feeds and everything comes in can predict up to 90% accuracy of when something's going to go on critical short. And I think that's just an indication or kind of an example of you can use AI to kind of make the supply chain more resilient. And from our perspective, it's more resilient as in a doctor doesn't run out of stuff or a nurse doesn't run out of stuff on the floor, right? There's all different forms of resiliency. I know I got another expert speaker here. And so for us, it's like the supply has to be there when they're treating the patient, right? And so if it goes on critical short, then our organization has to know how much inventory they have on hand, what they have suppliers and stuff like that. So that algorithm is just an example of how AI can help make the supply chain more resilient from a perspective of ultimately we care about, did the patient have a bad experience or have a bad outcome because that supply wasn't there, right? And so our part is really trying to predict that and give it back to the organizations as a canary in the coal mine. Hey, it looks like suppliers are running out in the supply chain and you only have a hand. You need to come up with a strategy quick, right?
Thanks, Tim. Archie, in fact, the GHX is also big in the supply chain side. So what are your thoughts? And maybe if you can also highlight a use case where AI has predicted the shortage before it has occurred.
Yeah. So, Sandeep, I think a lot of what Tim said really, really resonated with me. He talked about resiliency, and it's true. There's such a fragility crisis in our healthcare supply chain at the moment. If you think about everything that's happening in the world that impacts our getting the right products at the right time for the patient, you can see the stacks, the odds are stacked against us. From the provider side, so from the hospitals, from the clinician's perspective, if you think about the headwinds, you have all of this fragility in the supply chain management system. You also have, sort of workforce, and labor shortages. We don't have enough people to do the work that we need to do to get the right care pathways set up for our patients. And then, on the supplier side and even on the provider side, this is true. there is such pressure on margins, right? You are trying to make everything more cost effective. And so when you think about this perfect storm, to me, technology becomes another lever to actually address, what Tim talked about, the resiliency, and take away some of the fragility and the unpredictability out of the system. It should not feel like moonshot, right? I think a lot of us have shared that, yes, AI is here to stay. I think what I really do like to emphasize in healthcare, especially, that like any technology that works seamlessly, my favorite adjective is, having it be invisible. So when we think about the broader role of AI, we have to move away from, pilots to actually doing proof of concepts. And that's what GHX has been so good at, for the last 15 years. Similar to, the use case that Tim shared, we actually do use classic AI and now Gen AI, in several of our sort of addressing the fragility crisis, making sure that the right supply disruptions, if a boat hits a Maryland bridge, which supplies for which providers from certain distribution centers can actually impact, the surgeries that are scheduled. Having that ability to actually predict that disruption, right? It's not always a back order, it's not always out of stock, but even predicting that disruption and actually taking a step further, from GHX's point of view, because we are such an end-to-end, ecosystem partner for our providers and suppliers. It's a two-sided network. So when you think about, there is a disruption happening, but can you actually, aid your clinicians, your doctors, by even making alternative recommendations in the near neighborhood, right? Like, okay, if a catheter is going to be back ordered for the next 3 weeks, what are the next substitutes that we can recommend, which actually delivers similar or even better outcomes at more effective prices? That is something we take pride in, and we have our own AI model, which we like to call as a GHX Res AI or GHX Resiliency AI. And you can see how much, resiliency is synonymous, with what our customers are challenged with. Another example that actually comes to mind, beyond sort of making the predictions of what supplies are or what surgical supplies are going to be back ordered, and then which ones are going to be recommended as substitutes. Invoice matching. And I think Tim will identify with the use case that I'm going to bring up, where this idea of, all of these invoices coming through, and as the digital transformations have happened and the providers have moved to cloud ERPs, we still have huge discrepancies in the invoices that are being sent. So GHX actually has been using, AI models to make sure that we are, quote unquote, smoothing these invoices, taking those discrepancies away, so that, millions of dollars in missed credits, simply don't happen for our providers and our suppliers. That's what I think about when I think about AI working seamlessly and invisibly. So that is really where GHX is focused, and in sort of true value delivery for our patients, for our providers, and for our suppliers.
Great. Thanks, Chi. Now, moving on, there is another aspect where AI is being leveraged, is the predictive analytics. Kamal, knowing your background on the analytics side, let me start with you. So, in what way can AI-powered predictive analytics improve resource allocation and mitigate risk in the crisis situations?
Yeah, I think that's a great question. I think as we're thinking about predictive analytics and we're thinking about what are all those areas within healthcare that we can start to get better with in how we sort of plan and how we treat our patients. And an example that comes to me, I had read an article in the New York Times almost a decade ago where they had actually looked at the restaurant AI models, where restaurants were using software that was able to predict exactly how many people are going to show up where and what dishes are going to get ordered, so that they can most appropriately figure out what ingredients to keep in the kitchen and what dishes to prepare ahead of time and things like that. And also staffing, right? Like how many people, how many servers do I need from 4 to 8 versus from 6 to 7 or whatever, and optimizing it down to like the dollars and the pennies. Just imagine in healthcare being around 300 years, we haven't done anything close to that. Our staffing is all completely unoptimized. We have no predictability of who's going to walk through the doors. We have no idea of who's going to come in and what kind of like appointments we're going to be setting up. But then also, that's all the non-clinical side. On the clinical side, we also have very low predictability with as traditional healthcare, even with things around like what risks are for our patients, right? So which patient is going to get readmitted in the hospital? Which patient am I discharging that's going to be weak enough that they're going to come back in 30 days and hit me on a penalty for readmissions due to avoidable causes. So predictive analytics, I think, helping on both those areas is probably where we want to go. So I think the non-clinical side is almost as important as the clinical side, because we're burning resources in a way that is completely nonsensical in this day and age of what analytical capabilities we have. But I have had a lot of experience doing it on the clinical side, and it's actually very effective to start to think about the day patients are getting admitted for certain high risk procedures, or admitted to the hospital, or coming and showing up in the ER with certain symptoms. There's a lot of situations where me understanding and risk scoring these patients will help me appropriately triage these patients so that we can sort of have a better outcome and fewer side effects. This even carries all the way through. We have a really good example in melanoma, in oncology, where we know that certain patients do not do well on certain treatments, even though those are first-line treatments available. And if we know that certain patients are more likely to get certain side effects that are going to be game-changing for that patient, but we can start to use predictive models to be able to get there, we're now going to be way more confident and be able to give out treatments that are more effective for them. It is very hard or very difficult for patients to say, I'm going to give up on an effective treatment that's available just because there's a 5% or 10% risk of a side effect, right? But if I'm able to use predictive models and say, actually, for you specifically with your data and your type, that risk goes up to 60%. That's a very different decision framework. And I think we owe it to our patients to be able to provide things like that, given that we do have the analytical capabilities and the data available to do that.
Great. Yeah, absolutely. Very great insights and very well received. So Tim, in fact, you have a different exposure. So what are your thoughts on this?
Yeah, so I actually want to agree a little bit with him. We have a workforce application that looks at benchmarking on a daily basis that uses hundreds of providers. I think that's a challenge, as we want to continue to sharpen that and improve both the predictive side as well as tell people what happened. There's still a good case to be made for, prediction, but prediction from a past. So one example of that is we have a thing called care science analytics. We have 1 out of every 2 discharges in America, right? And we calibrate that every year, hundreds of variables. Did the patient have cancer? What was their age? And really look at what actual length of stay they had versus expected. And I think that really helps our organizations fine tune where they want to go after predictive models. So I think it has to be both. You have to look at what might be the challenge of opportunity, and then you got to deploy those predictive models. It's hard if you are deploying specific technologies and not really knowing where your opportunities are. So I think it's both. But I do agree, workforce shortages are challenges. And then there's healthcare delivery, especially inpatient, but also outpatient setting, is so complicated that sometimes it gets lost in a sea of numbers, right? And so one of the things we recently did was take some of those reports and turn them into an AI chatbot We use Databricks technologies. Recently spoke at a conference about it. And really what we're doing is working on delivering the insight to the folks predictively, like, oh, these are probably your area of opportunities based on the questions you asked, as you would ask a normal human, right? There's nothing wrong with analytics and reports, but sometimes it's good, especially some of the clinicians we serve, to ask the question as a normal human, what are my biggest opportunities and what's service line for readmissions, right? Where am I maybe having an issue with length of stay across our organization? That then highlights where to use the predictive models. And another vantage point.
Thanks, Tim. So, Archie, continuing on this topic, if you can share how accurate these prediction has been in the real world scenarios, that would be interesting.
Yeah, when I think about accuracy and sensitivity, especially as AI is concerned and relevant to AI, if I wouldn't use that model on my family, that is something like, if that answer is not resounding yes instantly, I'm not even looking at the data in terms of, accuracy and sensitivity. So I think, as builders, as innovators, I think we have to have that mindset. I think that becomes critical as we're thinking about things. But when you think about, what are the things that you absolutely have as must-haves before we actually put that kind of intelligence in the marketplace, three things come to mind. First things first, is it safe and predictable for the patients? Which not only means that, it works for a cohort of patients, but it works for everybody. I think that is the cornerstone, in healthcare. So when you think about the real life cases, whether it's, in my past life, when we used AI to actually do mammographic screenings, we actually learned that, while our accuracy was actually, over the roof, right, with the data we trained, it was actually 98% accurate. But when we actually launched it, it didn't work for certain cohorts of women in the global space because, that, for that demographic, we actually didn't train the model, with their data. So, that is actually one of the other things, that not only that it is accurate and sensitive for a certain cohort, but in real world data, it has to work for everybody before you put out there. I think on a closer note, when I think about, supply chain, as you rightly, predicted, pandemic, and how do you, were there use cases, that actually surfaced with greater accuracy and greater sensitivity? Yes, we were able to, very early in the pandemic, we actually used prescriptive analytics and classic AI to flag a spike in purchase order velocity and shipment delays for N95 masks. So based on those patterns, we knew something was brewing, and we flagged it almost 3 weeks before the hospitals could feel the crunch. I think that kind of heads up, where we have enough time to read out the supplies, engage alternative vendors, and ultimately, right, what we are all trying to avoid then was frontline downtime. So we've used similar models to flag shortages in, with other supplies. And I know that a lot of the good work is actually coming out of, Premier, Vizient, and other vendors as well, where they are building that kind of intelligence to make sure that, the right supplies, again, what we talked about, both from the provider perspective and the supplier perspective, that the care is never delayed. So, that's, I think that I would call that a win. And I would almost say this: I've been 25 years in healthcare, and yes, we've been one of the laggard industries in adopting technology. But I think if you look at pandemic, since the pandemic and then after, there has been this huge wave of, not only cloud adoption moving to cloud acceleration, and then all of the newer technologies like deep learning, like Gen AI, they are actually being adopted far widely and far openly than ever before. So I'm an eternal optimist. I think you have to be when you're in product and you're building things. But I truly feel like we are on that precipice of change.
Thanks, Sachi. Jeremy, let me get your thoughts on a different aspect. That what matrices are most useful to evaluate AI's impact?
For AI's
So,
impact on the supply
yeah,
chain.
yeah, on the
So,
supply chain.
so I think things to consider here are like time to recovery, right? How quickly can a supply chain return to normal operations after a disruption, right? And AI can help predict how fast that recovery time can come, right? Um, I think forecast accuracy, right? Um, back to Kim, sorry, back to the thought of like um, forecast accuracy, right? How fast can we get there? AI impacts on machine learning can generate improved forecast models and what that looks like. Inventory turnover and stock rates is something else that we can look for in this. Um, Supply chain visibility is a huge thing here. Supply risk score, disruption probabilities is something else to look for. Like things with that one, or AI supply risk dynamic using external and internal data, right? So we'll take what we currently have, what the supply has, see where we're going to get and what we need and how fast we need it. You know, things that I see still as an issue would be predictive health, right? Like we can take old data, new data with AI, try to do the predictive, but still, it still leaves a gap of like just a lot of guessing, right? And we're still trying to figure out a way to bridge that gap. Um, and then also something else that this will help with is like cost to serve. Like what is the cost chain and especially when we're talking like more recent, like tariff costs and that kind of stuff. Like AI is going to help that predictive cost analysis as well. I think just holistically speaking, this is a great time for us to have such a powerful tool to help us just evaluate, supply chain risks. Yeah.
Great, thanks. So, AI is actually also playing a critical role in democratization of access to care, especially through the virtual assistants and apps. Let's discuss that aspect. So, Kamal, let me begin with you on that. So, how can AI-enabled chatbots and apps be leveraged to improve access to care? And how do you measure patient satisfaction and trust in the AI-based tools like chatbots?
I think that's a great question. So we did a survey that was sort of done with one of the larger consulting companies on the two sides of it, which is the physician side or the clinician side and the patient side. Clinicians today, almost 65% clinicians nationally use a chatbot in their daily clinical work, which in my mind, I thought is much higher than I thought it was really. And about 80% or 85% of them actually find it useful on a day-to-day basis. So clinicians are already using chatbots. A lot of what they're using it for right now seem to be mundane administrative tasks, right? Write a letter for my patient for a medical leave, or draft a response back to my patient for something here or there, prior authorization, drafting, things like that. Although about 40% people have said that they've used it at least within the last month for clinical decision making, and looking at questions like, is there a drug interaction? Is there something else, right? So things that I would go to a resource book for, now I'm asking ChatGPT and getting my answers quickly, right? But 30 to 40% of the times, these ChatGPT tools, especially in healthcare questions, are hallucinating. So as a hospital system, if you zoom out of the provider realm, and if you look at it as a hospital, 60 to 70% of my providers are using it, and 30 to 40% of the times that they're using it for, there's a hallucination happening. Who's liable? Who's at risk? How are we going to manage all of that stuff? That's really one of the biggest questions right now in healthcare. A lot of organizations, and if you've seen one hospital, you've seen one hospital, and in setting up AI governance, everyone's taking a different approach. There isn't a national way to do it. There aren't a lot of guidelines on how you set that up. And then you could tell physicians not to do it. So that's 4 or 5 big hospital chains have very infamously have said, no one's allowed, and we're going to block it from our firewall. But you know what? They're going to go on the cellular connection on their phone, and then they're going to use ChatGPT there. So you could do that, but you may not get the intended effect that you're hoping for. Or you can figure out a way to make it safe and effective. And that is, I think, where some of the new innovation, I think, is needed in ensuring safety, efficacy, and accuracy for chatbots. But I think the signals are strong. It is here to stay. It is already being used, and it is already proving fairly useful for providers. And one of the downsides of ChatGPT is, even if it doesn't know the answer, it looks so elegant and confident that you have no idea, right? And so it feels very useful. And we need to make sure that that usefulness is paired with accuracy. On the patient side, what we have heard in terms of feedback is they love the ability to be able to use tools like this to be able to get their answers, but the reliability index is lower. So fewer patients actually find it convincing or useful than providers do. So, and I think it's a little bit of it is because it sometimes feels too good to be true, and it sometimes feels like there isn't a lot of basis for what they're able to do, right? So if you go and check on Google, you look at 25 sources, you make your own decision. Here you get one answer, and you're starting to get a little bit more nervous. We are noticing where hospital systems are providing locked down ChatGPT instances for very specific use cases for patients. And I think that if we did that and if we co-branded it with a hospital, I think that could start to get higher adoption from very fast.
Sure. Great. Jeremy, in your world, how has been your experience with these apps and virtual assistants?
That's a great question. So we encourage people to use AI. We're actually looking at implementing AI every aspect of the company as a whole, right? And the hallucinations within ChatGPT especially is a well-known issue, right? It's a good call out. What we're doing is, we're using AI right now for note-taking, right? That's where we're really testing it out is, ambient listening and taking those notes. But what we've done is make sure that that our physicians are going back and reevaluating that before actually submitting it, right? Because even then, we've seen, even with ambient listening, those hallucinations occur as well, right? We're just enter something that completely didn't happen inside the treatment. So we're seeing that even in different aspects outside of even ChatGPT, right? So, more recently, I've been doing more and more research about the hallucinations. They are a known thing across every industry, but more importantly, they're looking to fix that, right? And the prediction of the fix of hallucinations should be within 12 months, is what is being reported. So hopefully, as time goes along, this becomes more and more reliable and more accepted as we push forward.
Sure. Thanks. Now, let's discuss a different topic, how AI is changing the R&D landscape. So, Tim, let me start with you. What do you think, how AI is transforming drug discovery, especially in the complex domains like oncology?
Yeah, I can't speak to the whole chain around drug discovery. That is, like you said, very complicated. I think there's a number of ways, though, you can deploy AI to help, sometimes even connect providers to life sciences companies. Since we have 1 out of every 2 discharges in America based on our quality applications and other analytics we serve up to providers, we're able to look at that. We're able to look at all the diagnoses of the specific patients in the organizations and use that data for both real world evidence. Sometimes we have a historical pool of 20 years of de-identified data and kind of use that as a way to see whether or not the drug that was discovered and brought to market actually is impacting the outcomes that it was thought, as well as look at things like undiagnosed CKD, right? There's as many folks walking around that don't even know they have chronic kidney disease, right? So a variety of ways I think data can be deployed to help drug discovery. First, for matching, saying, well, these are probably good sites for clinical trials. There's a lot of hard time just finding the right patients. There's interest in outcomes, and using that to help that real world evidence in the very complicated process of proving outcomes. And so I think and there's a ton of groundbreaking work like in quantum and other excited that I won't get into, right? That's a little bit outside of what I do on a daily basis, but of course there's a huge promise in AI across the spectrum of drug discovery. What I would say is one of the tantamount problems is if you discover something, how do you trial it? And if you trial it, how do you prove it's effective? That's probably areas we're more focused in right now on helping in our limited aspect with our real world evidence data than trying to make quantum computing on molecules, which are other people's jurisdiction.
Thanks. Kamal, how has been your experience on this drug discovery side? And if you can also throw some light that how AI actually, how much it is shortening the timeline in the R&D pipeline?
That's a great question. So right now, I think one of the biggest issues we have in clinical trials in oncology, especially, is that a lot of these trials are not getting to a successful outcome. I don't know if people know this, but the chances of a molecule entering phase 1 and starting a study there, and for the chance of that particular molecule getting all the way to approval in oncology is as low as 4%. So 96% trials fail in oncology, which is a huge issue. And that is what is contributing to the cost of this industry. Right now, an average pharma company loses $60 billion a year on a failed trial. And that is what we are seeing in terms of cost and wastage that is happening. Now, the big reasons why these trials are failing, right, mostly around study design and failure to accrue patients. So either you're creating your inclusion-exclusion criteria in very specific and very narrow ways, in which case you're not accruing the right patients, you're not creating the right representation, you're not being able to get the right patients into the study. The study is too onerous, you're asking patients to do too much, patients are failing out, they're dropping out. For whatever reason, these studies are not getting completed or failed. This is outside of the molecular basis of what's going on, right? And in some cases, you're trying out some of these molecules in populations that may or may not be that suitable for whatever that is. So a lot of those different issues today we're seeing being addressed by AI in very interesting ways. So last year, we did a few pilots with clinical trial matching companies where we were able to increase the enrollment into studies by about 20% by just implementing an AI solution where we were looking for clinical trial candidates. So both from a population level view, but also from an individual level view. So if you're a patient that walks into the door with me and I'm looking at your data, can I run an algorithm that figures out which trials you're eligible for nationally? Or vice versa, when I get a trial, can I look through my million patient records and quickly figure out the patients that are in 90 to 95% match for the trials based on all of the data that's available, right? So matching all my inclusion-exclusion, not just doing demographic and disease level, which is very hard. So those are some tools that are being really effective in the AI world. The other tools we're also starting to look at is appropriateness, mechanistic appropriateness of molecules with their populations. So we have an incubation we're working on at Moffitt right now, where we use mathematical modeling to be able to figure out if there's a better way to design that study using the mechanistic understanding of the molecule, right? So understanding exactly the biological basis of how the molecule works in what population and starting to make better matches there so that there's a higher chance of success of the study and so that you can get away with a smaller sample size. And if I'm able to reduce the sample size by 25%, that reduces time, that improves success. You can do a lot with that. So those are two specific ways in which AI is being very effective. There's a lot of clinical trial matching companies now that are attacking it from all these different ways. But the biggest kind of like problem as you're thinking about implementing all these different things is how useful and labeled and annotated your data is within your hospital system. So I think the biggest barrier to a lot of these companies is they get into the hospital and they're like, okay, 90% of this data is useless. It's not in the right format. It's not structured in the right way. We can't actually query it, etc. So as we're thinking about changing the paradigm here and starting to look at AI more seriously, I think we need to make sure that hospitals are AI ready. And then a lot of these tools can come in and actually help figure out how to accelerate and speed this up. But I really think that AI is going to completely change how we think about clinical trials. Because even if we get the rate up from 3%, 4% to 10% success, like that feels like a small number, but that is tripling success rate. That will make everything go down, right? Like the cost of the drugs will go down, the affordability will go up, the losses that will go down. I think that'll make a huge difference in how we're thinking about it.
Thanks. Great. So now let's get into some of the implementation realities and questions related to ethics and trust. So Archie, we can start with you. Can you share how can cross-functional teams collaborate more effectively to balance innovation with the patient care?
Yeah, I think when a dating app hallucinates, it's funny, right? But something like that happening in healthcare is absolutely not funny. So I think we have to, and that is the unique part of, even what Kamal talked about, right? Like we have to put patients at the core of it and making sure our data is trusted, annotated, and of course, you have all the data rights for what you want to build. So we, at GHX, we've really sort of course, it's learning through hard, challenges of our own, but we've almost built away from, gone away from building for, a customer, a supplier, a user to how does this actually impact the entire end-to-end ecosystem? So, when we think about, like, let me give you an example. We were actually trying to automate, within the supply chain world, what happens in the operating room. So often cases, these elected surgeries, especially when you think about implants, these are arriving at the last minute, the charge nurse who's in the OR is trying to obviously assist the surgeon, but also trying to make sure at the end of the surgery that all of the supplies are captured and tagged accurately so that the right billing is happening, the right invoice PO is being generated. So as we were trying to do that, we're like, okay, you know what? It is about the charge nurse, but it is also about how do we actually look at creating an end-to-end ecosystem. So that really means, we are not just interviewing the charge nurse, we're actually embedding ourselves, shadowing in the OR how the surgery is actually taking place, where the scanners are coming in, where the credentialing reps are going out, actually, reproducing that workflow and then automating it. That has been sort of the difference in, how we used to build versus, how we think about building in the new world. Taking the insights directly from the users and automating those without adding complexity. Because, even in the example that Kamal was actually bringing up, yes, you are going to reduce it by, 2x, 3x, the sample data size, but you want to make sure that you're looking at the right cohort without adding that, complexity that is completely unneeded. So that level of, creation and sort of super focused on the outcomes you are trying to deliver without adding complexities has been the key. Because, in this world of vibe coding, right, where every product leader, every technology leader is being asked to do more with less. Like here, nobody's hiring new engineers, build fast, fail fast, break things. We just can't do that in healthcare. So I think we have to be mindful. And the only way to deliver fast, for our customers while, keeping it simple is to make sure we are embedding ourselves and, that customer empathetic design becomes key to delivering those outcomes.
Absolutely. Yeah. Tim, in your experience, what are the biggest barriers to successfully deploying AI in the healthcare, and how healthcare leaders can overcome them?
Yeah, I once had an old mentor that said, when in doubt, ship it out. I think like the prior comments about that's kind of really super dangerous in healthcare apply here. But the number one issue, and this is cited across the industry, and this is true, is 85% of AI, at least, pilots don't get to production, right? What's your path to production? That's the issue. And we talked a lot about hallucination throughout the panel. One reason why something hallucinates is bad data. It's not sexy to talk about data quality. It's not like, oh, this is awesome, like we were talking about build fast and break things. The number one issue of deploying this technology is not actually getting the technology deployed. That's actually kind of simple, right? Vendors are going to solve it. They're going to solve it better. Databricks, Microsoft, whatever your stack is. But if your data quality is bad, it's going to hallucinate, right? And so that's been a lot of our focus. A lot of what we've been tamping down recently on is how do we continuously improve our data quality? And we've been doing this, at least in my organization, for 20 years, right? We've been taking bad data, turning it into insights with hundreds of data quality roles. And that's how we have, several hundred AI models in production. It's simply smoothing out the bad quality of healthcare data into something usable for us specifically to deliver those models. And so I think when people think about how do I get this technology, no matter if it's real time or if it's, a daily or whatever it is really thinking about what kind of quality of the data do you need to have to make sure things don't hallucinate, to make sure you can get to production. So I think that's one of the main failure points in a lot of these things across many of our organizations is just great, giving us a bad answer. Well, why is that? Data quality is not quite there, right? And so I think that's just generally my option is my number one issue with the path to production is almost always data quality. Again, super boring. People's eyes glaze over. They're like, oh, talking about data quality. You can't. These newer tools, they have to have good data quality, just like the past. It hasn't changed, right? That would be my observation.
Thanks, Tim. Okay, Jeremy, on the security side, I know, knowing your background, what do you think? What are the steps that are being currently taken to future-proof encryption in the clinical systems, and how does this future look like on the security side?
I briefly touched on this earlier, but it really comes down to visibility, right? In staff training, right? Staff training is a huge part of this, right? Knowing how to handle PHI, when to report something suspicious, right? These are key elements of ensuring that PHI is kept safe and close, right? Um, you know, encouraging your tech teams about your DLPs, your data loss prevention policies, right, is a huge, huge piece of this. Sometimes it'll take years to get you where you need to be here, but starting somewhere is better than nothing at all, right? And again, third party SaaS oversights, right? Making sure that your partners are SOC 2 compliant, right? Make sure that they are doing annual pen testing, ensuring that they're not just checking boxes, that you're actually checking their governances, right? Ensuring that's also for your internal teams, right? Just ensure that these things are happening and occurring. And then again, if you're doing these things, you're prepared for the future when quantum computing is fully functional and rolling. That is really the key functions of this, right? If you're not SOC 2 compliant yourselves, like encourage your teams to start going that direction, right? Ensuring that you're following the best practices to ensure that patients' data is secure.
Yeah. Thanks. Archie, maybe another aspect is on the ethical side. So how can we ensure AI in healthcare follows ethical principles like fairness, transparency, and inclusivity?
Responsible AI. I think it's a it's as glazing over, Tim talked about. Like everybody likes to use that as a buzzword, but it really is the cornerstone of, how we think about any technology, right? Like building responsibly becomes the key. And when you think about the ethical, bias-free decision support that we need to provide for our customers, especially for our clinicians who are ultimately accountable for care, few things become critical. Number one, I think Jim talked about data accuracy, and making sure that, as it was recalled earlier, that real world data, you have to make sure it's labeled, it annotated, making sure that different cohorts and demographics, and it is inclusive. That is the place you start in terms of building the right insights and intelligence to deliver the right outcomes. Number two actually becomes, making sure that you have great data governance practices, and how you are, path to production is what we heard a lot about. I think it becomes a key feature of, like, there needs to be um, certain gate checks that you put through this AI council, and it can't be just product and technology. It has to be product, it has to be technology, it has to be legal, it has to be clinicians, it has to be validation, depending on what kind of software you're putting out there, leveraging AI. All of these cross stakeholders need to be coming together to make sure that the insights and the models are actually worldwide applicable and ready for production, right?
Sure.
So that's number two. And then last but not the least, I think this has been sort of my principle in how I launch products, especially AI and Gen AI. It has to start with building confidence and adoption with our users, and making sure that first things first, we're doing no harm. So having a human in the loop, especially as you are, laying out the first paths of adoption and creating that flywheel effect, that becomes critical, because we want to make sure that not only the clinicians feel good about the decision support they are getting, but the ultimate outcomes that we believe we are delivering for customers, you've had enough time to validate that, and making sure that there is empirical evidence built out before you completely automate and create this agentic ecosystem where things are automated and agents are talking to each other, because that's really where we are headed. So making sure that we actually have a human in the loop, do the enough building of evidence before we completely automate our, in some ways, our lives away to the agents in the ecosystem. So those are the three principles I would recommend to anybody who's dabbling into production world decision insights for healthcare.
Thanks, Archie. In fact, it has been a great and very interesting discussion. I didn't realize that we are almost at the top of the hour. But before we close, I would like to get a short piece of advice from each of you for the healthcare leaders who are looking to embrace AI in the right way. So what advice would you give to them as they are looking to adopt AI while maintaining the patient-first approach? Maybe, Kamal, we can start with you, and we can go with the rest of the speakers.
Yeah, thank you. I think one piece of advice on the health system side would be, get your data house in order and figure out your governance. Simpler the better, but again, obviously keeping effectivity and safety in mind. I think advice to entrepreneurs that are trying to enter this area and startup companies, I think nobody's buying AI solutions. People are buying solutions to problems that they feel. So problem first approach of really figuring out, here's what we're helping you solve, is a much better way of approaching it. If you start your pitch with, here's an AI solution that, etc., not really going to resonate still. Our eyes glaze over and we don't really care about how you're doing it. It's about what you're solving. So let's still try to keep moving in the same direction of solving the right problems that we all face in healthcare.
Absolutely. Jeremy, your thoughts? What advice you would like to give?
Ensure that you're embracing it, right? Like it is something that's not going away, right? Like this is becoming a way of life. So encouraging governance and policies around implementation and adoption of this, right? Ensuring that your staff know of hallucinations, but they're not just going off this as the only truth factor. That you still need to use other resources to ensure accuracy is there, at least until they figure out the hallucination piece. But embrace it, right? Go forward with it. Don't hold back, right? Again, if you embrace it and you put governance around it, people aren't going to go around you and do it other ways that pulling out their cell phone and using it that way, right? Just go forward with it. That's my advice.
Thank you. Tim, you're muted.
Quickly, I would say that it can get complicated quick if you start listening to too many people, and there's so many vendors pitching right in this space. So let me break it down, right? An old mine once told me, he was the smartest doctor I ever worked with, 100% of something is better than 0% of nothing. Start small, pick a use case, increment, right? If you get waylaid with all the vendors and the different things, the other thing I would say is radical simplicity. You do want to think about your tech stack. You do want to consider who you're going to partner with long term and not have 400 people in the boat. And the third thing I would say is, as a mid-cap company and most companies, we can't out-innovate the big tech players. So think of what you're trying to do as like the Voyager slingshot. It used the sun and Jupiter to go faster than any object any human has ever made. And it did that because it was using those bigger bodies for what they were good for, right? Don't think you got to go build all this stuff yourself. Mostly you're going to radically want to buy it. You're going to want to pick your technologies, and you're going to want data in the technologies. You're not going to want to get a whole bunch of enterprising data scientists to say, we can build our own chatbot. You don't need to do that most times, right? Go look for the tech stack that works for you. It'll vary by your perspective, but buy mostly, look for your partners, and make sure your data, of course, is AI ready for your specific use case. Try to fix it for all AI ready data use cases. You're not gonna make it. So pick a use case and go.
Thank you, Tim. Archie, finally, your thoughts.
Sure. I'm going to say two words: change management, because I think we've talked about technology, we've talked about data, but when I am going to share a story, I've seen real world example. I've seen a hospital roll out an AI-based scheduling tool that was perfect on paper, highest sensitivity, highest accuracy, trained on their own data, but it didn't align with the clinical preferences on the ground. The burnout actually spiked, the thing that they were trying to solve for. On a different side of the story, another team, same hospital, tied their rollout to weekly feedback sessions. They iterated quickly based on the feedback they were getting so that the model actually stayed the same. But how do you actually integrate it and drive the insights through the workflow without creating new workflows for the clinicians? That helps the clinicians build trust iteratively, incrementally. That made all the difference. So my advice to those who are building, yes, dream big, start small, but do not skip the change management. Think about how you're going to roll this out to your users. It is not optional. It is not just because you've built, they will come. Change management is a process, or it's an operating system for how we create a flywheel of adoption. And remember, these technologies only get better through adoption. So that's my final advice.
Thank you so much. All are really great thoughts, and I'm really glad and honored to be hosting this webinar. I see there are quite a few questions also, but some of the the speakers have already answered, and some are the ones which we have covered maybe in the subsequent section of this webinar. So over to you, Nitin.
Thank you.
We are
Yeah, thank you. I know we are on the top of the hour, and any questions which is left out, we will try to get it answered in the post webinar, where we will try to individually give the attention to the attendees who have asked the questions. But yeah, thanks a lot, Sandeep, for moderating this session beautifully, and we'd like to thank all our community partners, the eminent speakers who are there for today, which include Jeremy, Archie, Tim, and Kamal, to deliver the exceptional session. And we are grateful for your eagerness, first of all, to collaborate and impart your knowledge to all the attendees who are listening to you from all over the world. For everyone's information, I want to add that today's webinar was broadcasted live on LinkedIn Live. And for those who couldn't attend the session or wish to review it, the recording will be accessible on our company's YouTube channel. We are excited about the upcoming technological innovations, and we have a great events lined up, which include a lot of different industries where we do, like includes bank, financial, insurance, consumer goods, retail, media, healthcare, telecom, supply chain, manufacturing, and a lot more industries. So keep in touch for this ongoing education opportunities. Stay updated on tech news by visiting our website. Follow us on our social media channels. You'll find all the information of our events, about notifications, guidance, and support. Please engage with us and spread our content online. We extend our sincere appreciation to all our partners who have come with us for today's webinar. It was a pleasure to present this session. We hope you enjoyed it as much as we did. We look forward to more engaging sessions in the near future as well. Take care, and here's a great day, weekday, and year ahead. Thank you.
Thank you, everybody.